Good morning, colleagues. A lot has been said based on what I have on my paper, but for me, talking about religious leaders and their input to encourage men to help women contracept, it's not enough to get religious leaders and talk to them. It's to make them understand that they should talk to their male followership on their responsibilities of encouraging family planning as a familial care. That is, if you encourage your wife to contracept, it's part of the religious obligations that says you should take care of your family. The two major religions in Nigeria stresses about man being the head of the home. It's not being the head only, but taking the responsibility of being the head. And if you use the scriptures to make men understand that they have a responsibility to familial care, using the scriptures, I think it will pave better way than talking about religious leaders come together and talk. We have to really get the ingredients out for men to really understand. Then looking at youth involvement, I'm happy so many speakers talk about youth engagement or youth involvement in contraception. SFH has a project called Adolescent 360, and we tagged the girls program called Niger Girls. I'm happy we have Niger men here. But what we found out in our insight gathering, we used almost a whole year gathering insights around young people. What the young people said is that we have nobody we trust to give us information. So if they do not have anybody to trust to give them information, will they trust the social media, where they piece information together and add it to what they think is right and execute it? And this is why we are having the high rate of teenage and young people's pregnancies and the complications. They said, the girls said we trust our moms. But the boys were neither here nor there. Can men take the responsibility of talking to their boys, making boys feel that they have a responsibility of being boys, of being gatekeepers of their sisters, of being gatekeepers of their aunts, not as football players only? Then thirdly, I will turn to government and stakeholders. We have this ambiguous policy around adolescent sexual reproductive health. The definition of women of reproductive age is 15 to 49. But when we go out to give adolescent reproductive health services, some states will say you can't give contraception to a girl who is less than 18. But then we know that girl is hugely sexually active. I will paint a scenario we had in Lagos. This girl came in and took implant, one of the implants, and the mother came back after all the community entry and everything. She said it has to be removed. She brought a policeman, and that implant was removed, and the provider had to be taken as a photograph with the implant and the girl standing by. Very embarrassing. So when we talked to the mother, do you know what your girl is up to? The mother said, I know what to do if she becomes pregnant. Which means mothers, we are not taking up the responsibilities we should. We have what we call mom sessions. How do you talk to your children? They say, no, if I talk to her, it's like I'm encouraging her to become sexually active. Can we talk to them about the consequences of sexual activity when you are not really ready to be a mother? And the boys, to be sexually responsible when they are not ready to be fathers. Then talking about parents too. We found parents who make it the business of their children to feed the home. I remember a girl saying something in Yoruba. Incidentally, I speak some level of Yoruba. I said, what do you want us to do for you? She said, so far, I will be wakbe. Those of you who are Yorubas will understand what it means. That tell our parents that female children have better use than going out to bring breakfast to their parents. What are you encouraging the girls to do? And if you have this large population of young adolescents and young people, who are we going to graduate to become parents in the near future? Uninformed youths. But what they want is, we want to be informed, we want to be empowered. Is empowerment only about getting money? What about psychological empowerment? And we can only empower young people psychologically when they have education, they have something to do to earn money, rather than submitting themselves to transactional sex. We found that in our insight. And right now we are working on it. We have what we call the Niger Girls, where we looking at the insight and the opportunity areas to talk about empowering them with information. You wonder the kind of questions these young girls ask. If I sleep with a man using condom, am I still a virgin? What are we saying? Very, very upsetting. I'm a mother, I'm a wife. Though I don't have a female child, but I have nieces who are my responsibility. Would I want to be taking care of their daughters? What about the consequences of termination of pregnancy? Termination of pregnancy is a no-no area in Nigeria, but you and I know it's happening. How can we reduce that? Giving them information, knowing and they understand that they have a way out. We don't want them to contracept. Are we really saying the right thing? Like Dr. La has said, they found a lot of boys who are sexually active. We found a lot of boys buying misoprostol for their girlfriends to swallow. Those of us who are medically inclined here know what misoprostol is used for. And if the boy refuses, she annoys the boy, he will refuse to buy it, and because she wants to belong to a group of girls who have boyfriends who have arrived in their own terminology, she wants to sleep with the boy, but then she has no money to buy the condoms, to buy emergency contraceptives. So it is not only about talking here and doing that and making big grammars. Have we translated the FP 2020 commitments to the understanding of the community? I still go back to when we are talking about maternal health. There is this birth preparedness chart that we have. At different levels, everybody has his or her responsibility. Government, state government, community, family, and individual. Can the Federal Ministry of Health come up with something like this that can help us talk so that the messaging, as somebody has said there, is really directly responding to our commitments and directly responding to the needs of the Nigerian populace? Thank you very much.
Well, SFH has been long ago working with men. First, we do a lot around HIV, and with HIV, we do what we call dual protection. That is preventing HIV and at the same time preventing pregnancy using the condom, no sex policy, so that at least even if a sex worker is using condom, she's not pregnant, just so that we don't increase our maternal mortality. Then we have other projects that we have engaged men, because right from the word go, we understand that men are critical in the acceptance of family planning services in terms of information. So we've been doing a lot of interpersonal communication with men, that is men talking with men, either in groups or one-on-one, and to give them information about what are the benefits to you as a man and to your child. Because we notice that men are really concerned about their children's health, even more than the woman's health. Then they are looking at their pockets as well. So we bring out those two benefits, the health benefits and, of course, to a certain extent, the economic benefits for the man. And we've done that in several of our projects. For example, the MNCHU that a certain lady mentioned, we are the custodian of the demand generation bits, and we have what we call the male support groups. The male support group are not only even looking at the FP aspect. We are looking at involving men in maternal health care. Let them understand the risks in pregnancies, in unattended deliveries, and what happens to that woman if she has what? Inconsistent birth without spacing the child. So they are part of so many support groups within the community. They help in blood donation and the rest. So they really understand what the issue is for the woman. So when you come to talk about family planning, they become really acceptable, and they talk to their fellow men that, look, your wife need to rest. And recently we have the youth program around young adolescents. We are talking about looking at young married adolescents, and we have young men who are married within the ages of 24. You know, in northern Nigeria, we marry early. Between 24 and 30 years of men, we train them, and they are talking to their fellow young men, so that by the time they get to the age I am getting, they will have been what? Satisfied users, and they are really converts. So gradually they affect. And you know, young people like to move in a group. They have this, what we call the movement thing. They have like a movement, a group movement thing. We want to create that kind of movement around young people, either married or unmarried, so that they understand that they have a responsibility, not only to themselves, but they have a responsibility to their wives, to their children. And using the religious leaders who are largely men, talking to religious leaders, making them understand that even in religion, you, the man, has a responsibility to your family, and one of the responsibilities is to see that your wife is healthy, and the bedrock of health for the woman is child spacing. So we do a lot around men to get the message across, and it is really, really catching on. The program we're doing in Kaduna, we see men bringing their wives to the facility for contraception, which is for us a big encouragement for us to continue. Because we started initially targeting the women. I remembered issues where men will come and want to harass the nurses for giving their wives family plan. But that has changed, because the men are getting to understand that they have a responsibility towards contraception. Not only their wives contraception. Some men will say, I'll use the condom, because if I'm not sure, the side effects you are explaining to me may affect my wife. You can see the size of responsibility of the man. I will use the condom, but I will talk to my wife if she agrees that we can use the condom. So encouraging interspousal communication between the man and the woman is also another way we are using to encourage men to support their wives to contracept. Yeah, the issue is, let's complement each other, because there is no one organization that has it all. There's no one. Some organizations are very good with service delivery, but are they very good in demand generation? Are we ready to share? Can we share attributes? Can we work out attribution, so that it's not as if you're taking away my clients, I'm taking? No, we can share attributes. And if the donor will understand that no one organization has it all, the attribution percentage shared by each organization becomes what? A tool for synergy between these organizations.